I've recently been tasked with overseeing the health insurance marketplace Navigator program for the North Central Florida leg of the state program. So I'm going to give you a little bit of a background on what the Navigators are, but I really want to just delve into what people with special medical needs need to know about the Affordable Care Act and important things to know when going into selecting a plan. Okay, so as I said, I oversee the Health Insurance Marketplace Navigator program for these counties in North Central Florida that are listed here. These are 15 counties of WellFlorida's service area. The main project is out of the University of South Florida, which is in Tampa, but they have subcontracted with several partners across the state in order to cover the entire state. So WellFlorida sees the 15 counties in North Central Florida. I can say, since open enrollment has closed, and right now we're just kind of, doing some special activities as well as gearing up for next year, that our area is extremely unique when it comes to health insurance in Florida, mainly because of the rural and geographical layout of the region. And I'll get into more of those issues in a second, but rural areas have a lot of difficulties with access in general, so getting them to get insurance that meets their needs has also been a challenge. So the Health Insurance Marketplace Navigators are a type of application assister. I don't know if you've heard anything about other types of application assisters, but there are several kinds that are available since the Affordable Care Act came into fruition. There are also certified application counselors, which are similar to Navigators, but they're usually located at a central location, such as a hospital or a clinic. So the Navigators are similar to the certified application counselors, except they're mobile, and they are through a federal grant from the Department of Health and Human Services. So there's a finite number of Navigators that came from this USF grant that originally came from the Department of Health and Human Services. And their role is to be, hands-on out in the community. They're not based at one location like the certified application counselors are. They can travel to different areas of the community. They can navigate someone in their home or at a library, that kind of thing. They have to go through a 20-hour federal training, and then they also have to get licensed with the Department of Financial Services through the state and a background check. So these people go through a lot of processes in order just to become a Navigator. Also, their services are free because their funding is provided by the grant from the Department of Health and Human Services. The last type of application assister is an insurance broker, which is still a person you can go to for insurance information. The reason that there is a distinction now for the Navigators and insurance brokers is that the Navigators' main focus is to give an unbiased explanation of the insurance plans that are available. An insurance broker will still do a good job, but they might want to sell you a specific plan. They might not. But the only way to know that you're getting an unbiased delivery of what is available to you is through the Navigators or their certified application counselors. Okay, so health insurance marketplace basics. You guys probably know about this already, but I'm just going to go over them briefly since they are kind of the main staples that we keep hearing over and over again. Through healthcare reform, all of the plans on the marketplace have to cover primary care no matter the cost of the plan. So if you get the most expensive plan or the cheapest plan on the marketplace, they're all going to cover primary care annual visits. All of the plans now have to be laid out in a simple language, which I'm going to go over a little bit later, of what services you get through that plan, the costs out of pocket for different services, the prescriptions you get for different levels of services. So it's very important that you or the person that you're dealing with really goes through that simple plan information to make sure everything they need is covered on that breakdown. Consumers can no longer be denied coverage due to a pre-existing condition, and there's no lifetime maximums. So this is a really big deal. So now you can continue to get services for your medical condition and not worry about going bankrupt because there's not going to be a lifetime max for your insurance plan. And there's also an ability for some consumers to receive financial assistance in the form of tax credits, which is a government subsidy to help you pay your insurance plan. it's kind of a case-by-case basis. A lot of people come up to me and say, oh, how much money do I get towards my plan? And it really, really depends on your family size, your income, and the zip code in which you live in. But if you sit down and enroll yourself, or you enroll with a navigator or an insurance broker or application counselor, you can ask to see if you can go into the system and ask, here's my information, am I eligible for getting subsidies? And they'll come up with an answer of how much you can get towards your subsidy if you are eligible for one. And the subsidies can go either towards your monthly premium, so they can help reduce your costs so that you're only paying so much out of pocket each month, or you can get them in a lump sum when you pay your taxes next year. So in our area, we have experienced a lot of people with subsidies based on their income, but like I said, it is a case-by-case basis. So there are some good calculators out there that can give you a basic idea, and I can share that information with you on what you might be eligible for, but the only way you'll know for sure is to enroll in the marketplace. And the only way to get these government subsidies is through healthcare.gov. If you enroll any other way, then you can't be guaranteed the subsidies. So that's really the major pull of being able to enroll in the new streamlined system, is that you'll be able to find out if you get subsidies towards your coverage. Okay, so open enrollment closed on March 31st, 2014, and it was a wild ride. We had been working with the Navigator Project since November of last year, and nobody knew what the system was going to look like, and I'm sure you're aware of all the website issues and the date changes, and we were working on that. We were on the ground with that information every day. It was really, at times, very challenging, but now open enrollment is over, and we can all kind of reset, recoup, and get ready for year 2, since we know what things look like, and we can more easily take on the next period of open enrollment. So an open enrollment opens again November 15th and is until February 15th for 2015 coverage. So if you enroll on day 1, like November 15th, the earliest you're going to get coverage is January 1. So make sure you keep that in mind when you're planning your coverage. And the window is much smaller this year, so it's important to get off the ground running with getting enrolled. There's no limited enrollment period for Medicaid or CHIP. So if someone becomes eligible for Medicaid, that enrollment is year-round, as well as the Children's Health Insurance Program, which is known in Florida as Florida Kid Care. But the national program is known as Children's Health Insurance Program. The individual responsibility requirement, this is the thing that's getting people all upset, and it makes sense because now the government is requiring everyone to have coverage by a certain date. If you did not enroll by March 31, then you will be subject to a penalty on next year's taxes, which will be $95 per adult, $47.50 per child in your family, or 1% of your income, your family income, whichever is greater. So right now, a lot of people, not a lot, but a good amount of people are opting to take the penalty because all the plans on the marketplace are not affordable to them. But in the coming years, that fine is going to get much, much greater. I didn't put it in here, but I think it's $700 or 3% or something like that. And by 2016, it gets outrageous. So it's at that point, what they're trying to do is just make you buy coverage instead, because it's going to be the same price essentially in the end of paying a penalty and getting no coverage, or getting coverage and paying the same amount. This is some IRS tax information, since this is kind of the next thing. I don't know I think the internet's working. Oh, I'm not sure if we can see it. But I shared this presentation, so it will be available to you, and you can click on all the links. But the IRS has a nice website and fact sheet, like a one-pager that you could print out and hand out to people on how to claim everything that's been going on with your health insurance information on the next tax period. So if you have questions on how to notate that or what it means for you, I would go to the IRS website, specifically to the Affordable Care Act or the health reform page, and they have a nice little one-pager that you can share with people. So even though open enrollment did close on March 31, there is still ways for people to enroll if they have if they qualify for a special enrollment period, which is when you have a life-changing event. And a life-changing event includes having a baby, moving out of state or to a drastically different area. So if I were to move to Orlando, I would probably qualify because there's a lot more plans available to me there. Or a lot of ones in the younger population that we're experiencing is aging out of your parents' plan, which is when you turn 26. So if you qualify for one of those, then you can actually go online and enroll. You have 60 days after the life-changing event to enroll in marketplace coverage. I suggest individuals to do it early before the life-changing event occurs so that they don't experience a gap in coverage. Okay, so I want to go into the marketplace plan categories. There's different sort of metal color of categories depending on the cost out of pocket towards your, and then compared to your monthly premium. So there's the bronze, silver, and the gold. And then there's also the platinum, which I'll get into the next one. But for the bronze coverage, your health plan pays 60% of the coverage on average, and you pay about 40%. Silver is your health plan pays 70% of the medical costs, and you pay about 30%. Gold is the plan pays 80% of your medical costs, and you pay about 20%. Platinum is it pays 90% of your medical coverage, and you pay about 10%. But this is depending on how much you're paying out of pocket when you see the doctor or when you access the service compared to what you're paying per month. Just really quickly, the catastrophic coverage is also available, but it's only available for people that are 30 years old or younger. It's kind of aimed toward that young invincible population where they're never going to want to buy insurance anyway. So they have catastrophic plans that are they are less than 60%. But when they do actually access the service, it's a lot of out-of-pocket costs. So it's generally aimed for people who, they're forced to buy coverage, so they don't really want coverage. They're getting coverage that is still going to cost them a lot when they go to the doctor, but they are insured, so they won't have to pay the penalty during tax season. So for the insurance categories, if you expect to have a lot of doctor visits or need regular prescriptions, the gold or platinum plans are the best bet because you pay higher monthly premiums. So everything, when you pay month to month, it's going to be a higher cost. But when you go to the doctor, your out-of-pocket cost is going to be less. So it's generally for people who access services more often. If you don't expect to use the regular medical services that often, or don't take regular prescriptions, then the bronze, silver, or catastrophic are probably a better bet. They cost less per month, but they cost a lot more when you actually do access your services. So this is more about the premium tax credits or government subsidies or whatever you'd like to call them. If you qualify to save, so if you do fall into if you do the online calculation or if you use one of the tax credit calculators and it says that you might qualify for premium tax credits or government subsidies, then the silver plan is the lowest plan that you can buy. They won't let you buy a bronze plan with the government subsidies. So that way, if you choose this option, you will get the lower out-of-pocket cost of a gold or platinum plan, but you're paying the silver plan premium. So it's a little confusing, but if you qualify for tax credits, this is something that you're going to want to research to make sure that you get the silver plan, but also get a plan that best fits your needs depending on what they may be. Okay, this is really important, and I really wanted to spend the most amount of time on this. This is a summary of benefits coverage. When I said earlier that all plans are now required to offer, to explain their benefits in very plain English, in a very simple way, in a chart form, to show you what is covered when you go to the doctor, when you access the service, it's called the Summary of Benefits Coverage, or the SBC. And I took out some particular things that are important to consider when you are selecting a plan and you're looking at the SBC. And those are how much your deductibles or out-of-pocket costs are going to be depending on how often you access the doctor, what your provider network is, and this is a big one for people. A lot of people would come to me and want to enroll in a plan, but then they wouldn't. They say, well, I really want to keep my doctor, and I'd say you need to talk to your doctor to see what plan they're on. Unfortunately, right now, there's not a way that you can, select the plan and then it'll pull up a list of doctors who are on it. Doctors change in and out of plans so frequently that it's really best to call your doctor's office and ask him what number and name of plans he's on. So that's important to do before you even start enrolling, is make those calls with those people that you have connections with to make sure they are in your provider network. You can still go to a doctor that's out of your provider network, but it's going to cost you a lot more, so it's better just to select the plan that your doctor is on. Another thing to consider when looking for coverage is the copayment or coinsurance on prescription drugs. Depending on the kind of drug, there's going to be Your insurance might pay a certain percent towards that drug and the other percent you pay out of pocket. So if you take drugs regularly, you're going to want to find out which tier your drug is in. We'll get more into that. Home health care rehabilitation services and durable medical equipment, you're going to want to see how much your plan pays towards that. Services that are excluded, and again with medication benefits. All right, so the first one is comparing your plan's summary of benefits coverage, which is the deductibles and out-of-pocket cost limits for each plan. If you or someone in your family who is covered on the plan, so remember your plan is for you and your family members depending on their situation, and they're likely to require regular healthcare services or particular healthcare services, it is important to know how much you're paying out of cost for those services when you choose your plan. So keep that in mind, knowing whatever your medical situation is, that you're picking a plan that is going to best suit the medical services that you'll be utilizing on a regular basis. The next one is provider network. So if you have a long-standing relationship with a medical provider, you want to know if they are on your network or on your plan or the plans that you're considering. You also want to know if the plan you're considering includes doctors with special knowledge of your condition or your health situation. And again, you need to contact your healthcare provider directly to see if they're on the plan. So copayment and coinsurance on prescription drugs. The summary of benefits coverage will say what the copayment or coinsurance is on generic drugs. So for example, there may be a $10 copayment for a generic prescription medication. On the other hand, you share the cost of a preferred brand drug that might be a coinsurance of 20%. So your 20% coinsurance payment for a brand drug that is $200 will be $40. So make sure when you're looking at the plans, the generic drugs versus the specialty drugs, how much coinsurance is out of pocket, because that is what you're going to pay when you go to get your prescription filled. Okay, home health care, rehabilitation services, and durable medical equipment. Most plans have some basic information about these three types of things, but I still think it would be safe to contact the plan directly. And when I say that, I mean, in the service area I live in, really Florida Blue is the only provider. So I would call Florida Blue. I said, I'm interested in purchasing Plan 43C. Could you tell me if a motorized wheelchair what the copayment is for that? And they will tell you that information, or they will be able to send you a list of that detail, but they may not have a detailed breakdown in the summary of benefits coverage, so make sure you do your research before you actually select their plan. So for example, if the plan charges a 30% coinsurance on durable medical equipment, and it's $10,000 for a complex rehabilitation technology like a motorized wheelchair, and your copayment is 30%, then you're going to be paying $3,000 for that motorized wheelchair. So again, make sure you know your needs and assess your situation. Do your research, call Florida Blue or whoever the insurance provider is, and select the plan that will be able to fit those needs. Okay, annual and lifetime limits and excluded services. As I said before, there is no longer annual lifetime limits or excluded services. I'm sorry, annual or lifetime limits there are excluded services with healthcare reform. So they can no longer say, no, you've maxed out your insurance, you can't go to the doctor anymore. They can't do that anymore as of January 1 of this year. However, there are some benchmark plans that might contain limits on the certain benefits of services. So they might not have, they might have a max on how many times you can purchase a motorized wheelchair. I haven't really heard of that happening, and I'm sure it's a very unique situation, but make sure that you know the intense details of the plan. If you know you're going to have to purchase a motorized wheelchair, make sure you know the ins and outs related to purchasing that type of equipment on your insurance plan. They also might limit the number of visits of a particular service. And I'm not really sure what they mean by particular service. It might be, therapeutic or something like that. But make sure that you know that if you know that you're going to access a service multiple times, you know roughly how many times, and it's a unique service. Make sure that is included in your plan when you select it. Also, it contains a partial list of excluded services, which include, a lot of times it includes infertility treatments, cosmetic surgery. So make sure if if you're planning on having that part of your plan, make sure you contact the plan directly for a full list of excluded services. Because again, they won't have the entire list, unfortunately, but they will if you contact the certain plan that you're considering purchasing directly. Medication benefits. Okay, this is a little more about your out-of-pocket costs when you go to the pharmacy to fill your prescription. All of the drug plans are on a tiered pharmacy benefit structure, and drugs on each plan are organized in tiers from lowest to highest co-payments. The least out-of-pocket costs are going to be in tier 1, and generally it's generic drugs. A lot of times those are free depending on what it is. In a 4-tier plan, the second tier includes brand name drugs that the plan prefers. So you're going to want to make sure you look to those preferred drugs. If you have a drug that's not in that category, you're going to want to consider a plan that's going to have less costs for buying a drug that's not in the first 2 tiers. The most out-of-pocket costs for non-preferred brand or generic drugs are listed in tier 3, and specialty drugs are in tier 4. So if you know for a fact what drugs you're taking regularly, make sure you look at the summary of benefits coverage and the tiered pharmacy structure to see where it is, because that's going to be the costs for you each month. So this is the National Disability Navigator Resource Collaborative, and they have a lot of awesome resources for persons with disabilities, and just really great fact sheets on any questions that you might have. A lot of the breakdown of the things I used in this presentation was from this website. I had questions myself on durable medical equipment and home health care, and they answer it in all of these. So I would really recommend you going to this website and using their resources. They're all free, and they have typical FAQs that persons with special medical needs will be asking. So again, it's the National Disability Navigator Resource Collaborative, nationaldisabilitynavigator.org. I would encourage you to go to that website and look at all their resources if you have any questions that are to particular medical situations. Also, and I didn't mention this earlier, but you can preview your marketplace premiums on the website before even enrolling. So say you have health insurance now, or you don't have health insurance now, or you're getting ready for the next open enrollment period, you can put in all your information as if you were enrolling and do everything but enroll, and it'll show you which plans are available in your area and what your monthly premiums are. Now, it's not going to be perfect because it's going to be a little bit different once you put in all your actual tax information and things like that. But it's a great way to just kind of get a good preview of what you might be paying. And it's really helped out our consumers a lot because they come in and they're like, oh my gosh, I'm going to have to pay so much money. And we show them this preview plan. They go, oh, I'm only going to have to pay so much a month. I thought it was going to be a lot more than that. And it will show you the plans based on their metal as well. So if you know you're looking for a silver plan and it'll show you your preview of plans, you can just sort by silver plans and just look at the silver plans. Generally, it will also tell you the name of the plan that you're previewing. So you can even click on it and go to the health insurance website. So like you could go to the Florida Blue website and look at every single detail of that plan while you're sort of window shopping. So I would really recommend doing that as well if you want to play around with that. And that's on healthcare.gov/find-premium-estimates. They used to have it on the main page, but since open enrollment is closed, I think they kind of hid it somewhere because they don't want people thinking they can enroll and then not enrolling. So you have to actually type that in, but it will take you to that page, and it works really well. So definitely use that tool either with yourself, with your family, or with someone you're caring for, because it really helps alleviate a lot of unknowns. So enrollment questions. If you have enrollment questions, you can go to healthcare.gov and find a list of assisters in your area. Again, I oversee the Navigator Project for North Central Florida, but if you live in Central Florida or South Florida or North Florida, you just type in your zip code and it shows you the areas, the organizations like mine and others that are in your area that have people like me and other types of assisters like certified application counselors. So if you have any questions, you just want to find someone nearby, that's a really great tool that really helps you locate the organization of what you're looking for. So that's localhealth.healthcare.gov. So even though open enrollment has closed, the Navigators are still available. We are still working on a government contract that is through the end of this year. So while we are, gearing people up for the next open enrollment period, we're still offering assistance to people who have questions about their insurance plan. I know in my area especially, a lot of people who have insurance now have it for the first time. So they might not know how to utilize the services or even make a doctor's appointment or fill a prescription or follow up on those types of things. So the Navigators are still providing assistance. They can do one-on-one and say, oh, you have a question about your plan, let me help you connect you to that. Or they can do group presentations. I've done a lot at small businesses because that's kind of sort of the next thing on the horizon is the small business marketplace. So Navigators are still available to answer your questions. So even if you are enrolled or haven't enrolled, but you're not really sure what's going on, go ahead and call up a Navigator. They can answer your question. There's no reason for you to be in the dark about what's going on. It is a very confusing process. So useful resources. It's been plagued with errors, but healthcare.gov's, so when you go on healthcare.gov, there's a enroll. There used to be an enroll button, and now there still is if you have a special enrollment period. There's also a learn button, and that learn button is actually very, very useful, and I use it a lot. So a lot of the basic health insurance information that was in this presentation was taken from healthcare.gov. So if you just have a question on what coinsurance means, go to healthcare.gov. If you have a question on, I have employer coverage but my spouse does not, what does that mean for me? Go to healthcare.gov. If you don't want to call up a Navigator, you can easily do your own research. And I will say the healthcare.gov's learn portion has improved a lot since open enrollment. And almost every question I have has been on there. Also for professionals, so like healthcare professionals and other people interested in just learning about the marketplace and the processes involved in healthcare reform, there's marketplace.cms.gov, and that has all of the Navigator training, so you could even look at what the Navigators learn. It's 20 hours long, so if you're bored or if you want to fall asleep, go ahead and read the Navigator training. It has fact sheets for individuals, small businesses, it has presentations, it has little YouTube videos, it has a lot of really good resources for professionals. You could put it in your office, you could give it to someone that you're working with. So I would recommend exploring that site because you really can learn a lot about what healthcare reform means. Okay, and I like to put this at the end. Reminders for you and your community. So since we're post-open enrollment, I just want to make sure everybody knows that these things are important to continue your coverage. Is make sure you pay your health insurance premium every month in order to secure your coverage for the next month. Schedule appointments with your providers because primary care is included, so you're not going to pay anything out of pocket for that, no matter the plan that you have. So, make sure you reap the benefits of your plan. Make sure you schedule an appointment with a primary care provider. Make sure you're getting those annual exams that you have the right to now with your new plan. If you have any changes in your situation, or maybe you change your address or something like that and you enrolled in healthcare.gov, make sure you report those life changes to the marketplace, just so it's kind of similar to the IRS system, just to make sure that they have the most accurate information for you, and when you go in again, they'll be able to give you the appropriate plan depending on your area. Okay, this is my information. The website that for this program I gave you, I think you all have flyers too that look like this presentation. That's the pamphlet for my program. Again, I'm in North Central Florida, but again, and I can connect you to other areas of Florida as well. But we have a lovely website that's based off of that brochure, and it also has a event calendar, which has been really useful. So you can, click on it and go to places in your area that have a Navigator there that's there to answer your questions. And they have phone numbers for each of the county contacts. If you want more program information, you can email marketplace@wellflorida.gov, or that is my cell phone number, and that's also my office information. So, hopefully with all of this information, you can get off the ground running for year two and get the information that you need to better your health insurance situation. So.
I wanted to ask, I already have met with my Navigator and signed up. I haven't used any of the insurance yet. At the time, I wasn't working, and because of however it worked out within the computer system, I had enough credits to where it bought my insurance for the year, and I don't have to pay anything for it. So I thought that was awesome.
Right.
But she said that that could change at the end of the year. I am now working. And how will that change? Will I be penalized? Will they hit me with a big, I've got to pay tens of thousands of dollars at
Right,
the end
so
of the
you're
year
gonna
type of
wanna-
thing, or what's going on?
Right, so you're going to want to be careful with that, and I'm not sure what your navigator suggested that you do, but when you have a drastic change in income, basically from not having income to having income, it's going to change your subsidy situation.
Right.
So the subsidies that you got were based on when you were not working, so that's probably why you got the whole year paid. If you go in now and report the changes to the marketplace, it'll reassess your subsidies, and you may have to start paying a little bit per month. But if you don't do that, you'll have to pay everything next year when you pay your taxes. So when you pay your taxes and they find out that you did have income starting a certain time, they're going to say, well, you should have been paying for your health insurance starting this date. Now you have to pay X amount of money because you should have been paying that the whole year. So I would suggest doing it now so you don't have to pay a huge sum at the end of the year. So you're paying a small amount until you pay your taxes next year.
Okay. So call the number on my card?
Yes.
Okay.
Yes. Very good.
And that's the carrier I call, not the navigator?
I would you can do it with a navigator or you can do it yourself, but you need to go on healthcare.gov and report the changes, or you could call the national hotline, which might be the number
Not
that
the
you have.
insurance company that's on the insurance card?
You could do it with the insurance company, but they might direct you back to the federal
Okay, because that's the only
system.
number I have.
Okay, yeah, they will probably be able to connect you to the right place.
Okay.
But they also might want to be like, we don't want to deal with the federal system, go do the federal system first and then come talk to us. So,
Okay.
But it can't hurt to call them as well.
All right, thank you.
But way to be proactive.
Great presentation.
Oh,
thank you. My son is currently under my Blue Cross Blue Shield of Florida. He has a brain injury. He's 26, and he's on Medicaid as well. He is disabled, so the Blue Cross has to keep him. If something happens and I retire and he can't get the Blue Cross anymore, can he get this affordable health care?
Yes, he can.
Okay.
Since he has special coverage, that's why he's able to stay on your plan, and he will be able to do so. I'm assuming Blue Cross
Correct.
has that. Yeah, so that's great. So if you do retire, then he will be able to enroll in the marketplace or get whatever coverage he's eligible for, whether it be Medicaid or something like that.
And then the Medicaid wouldn't be in effect. It would be just the affordable. Oh,
It
you do?
depends. It depends on his. I mean, I'm not real. Unfortunately, I don't know a ton about the Medicaid enrollment because with my population, a ton of people who I thought would be eligible for Medicaid ended up getting kicked back, and they weren't. So it really just depends on the Medicaid office. But if he's not eligible for that, then he is able to go on and enroll in the marketplace.
Thank you.
No problem.
I don't know if you know the answer to this question.
I'll try my best.
I understand, since this is the first year for, the health marketplace, that a lot of folks that have not had coverage in the past are going to now have coverage and be getting services. So there's an expectation, it depends who you talk to, that in year 2, premiums will increase substantially. What do you know about that?
I get this question a lot, and unfortunately, I'm not an actuary or anything like that. But I can say that, in general, prices are going to increase every year because they increase every year before health reform anyway. So now that everyone's in the pool, it is going to increase. So unfortunately, that's kind of the way it is. I wish that it was, I wish it didn't hurt so much. But there will be an increase. But again, there still will be government subsidies for people who are eligible for them. Another thing, I just want to throw this in really quick, that is a positive. I always try to focus on the positive because in my job it's really easy to get depressed when people don't qualify for things. One positive is through the Affordable Care Act, a lot of people were turned to other types of coverage that they maybe didn't have knowledge of before. So in areas that did expand Medicaid, unfortunately Florida was not one of them, millions of people were able to get covered under Medicaid for the first time, and that's a really great thing. Also in Florida, I do know that families with small children were able to get coverage through the Florida Healthy Kids or the CHIP program, and only because they were forced to get coverage for themselves and they found out their children were eligible for CHIP and now their children are covered. So, there's a silver lining in the sense that, a lot of young children are now getting covered and for no cost and more people are getting in Medicaid, but yes, unfortunately, we're going to have to deal with rising premiums as a result across the board. Yes.
Hi, Lauren.
Hi.
Must you be a resident or a U.S. citizen to qualify? In
That's
South
a
Florida,
very
we
good
have a lot of
question.
immigrants.
That's a very good question. You do not need to be a U.S. citizen.
Okay.
You need to have a green card or some sort of documentation stating why you're in the United States. Unfortunately, we can't not deal with illegal populations. But everyone else, if you have documentation, if you're living abroad or anything like that, you can definitely still enroll in coverage.
Okay. Because we do have illegals that get hurt in South Florida that end up in our hospitals.
I know.
and I was wondering if-
Unfortunately, the illegals, because we have a population in North Florida of that as well, migrant farm workers and things like that.
Right.
So what we have been doing for them is kind of what we do with the people who fall into the Medicaid gap. We say, here's a place where you can get sliding fee scale medical services. Unfortunately, and most of them don't even want to come near us because they don't want to get in trouble because they don't want to put their information in the system.
Right.
But we still encourage them to talk to us because if they have children who are residents, and they can get covered. So, it's a sensitive situation, but we definitely try to get people into any type of medical care that they can if we can do it for them.
All right. And the other thing, especially in TBI, a lot of families when they get involved in this situation or on this journey, as we call it, you may be employed and you may have to quit work to take care of your loved one. What happens under change of life if you decide to quit work and let's say you're under group policy and you don't want a COBRA? Can you go on to this? Because the COBRA is super expensive compared to the rates that I've seen on the website.
Yeah, that is very difficult. That is going to be sort of a personal. You're going to have to do that best for your personal situation. I've dealt with a lot of people who are on COBRA, and a lot of times, at least in the beginning, if you had a COBRA plan that was considered unaffordable, you could drop it and then go online and get the health coverage. But I was always very cautious with those people because I was like, make sure that this is exactly what you want to do because once you drop the COBRA, obviously you can't get it back.
Right.
So yes, if someone decided to leave their work, they could definitely enroll in the marketplace.
Okay. Thank you.
You're welcome. It's kind of tall.
All right, you were saying that the monthly premium has to be paid, otherwise the policy will be canceled.
It depends on the policy, yes, essentially, but usually they give you a grace period.
Well,
So-
what my question is, can auto payments be set up?
Oh yeah, definitely. You can definitely set up auto payments, and
All right.
I definitely recommend that to people. In my area of service, a lot of times people don't have the means to do auto payments because they don't have a regular bank account. So they have to actually send like a check every month or something like that. But if you have the ability, if you have a bank account that can be set up on autopay, definitely do that.
And with the CHIP program, if parents are covered under their own insurance, can the children possibly be eligible for the CHIP? And does your income have any effect on that?
Yes, your income does have effect on it, but it is still possible to have your children covered in CHIP. I deal with people all the time who have employer coverage, but their employer coverage isn't fantastic, so they're able to enroll their kids in CHIP.
Okay.
So it really just depends on the situation again, but the marketplace will tell you when you put in all your family's information, hey, these two kids right here, they're eligible for CHIP, so we're going to take them to the CHIP application.
Okay, that's it, thank you.
No problem.